To perform active range of motion of the spine, we do so in a standing position. It's important to make sure that your client is standing just in front of the table, because when we go into extension, knowing that that table is there if they need to sit down or fall backwards is very comforting. We start with flexion. As we go through these motions, we'll make sure our client knows that if at any point in time they need to back out or they feel like they're getting into trouble, that they can. They do not have to push through the pain. So starting with flexion, what I'll get you to do is just put your hands on your thighs like this, and nice and slowly start to bend down and try and reach your knees. And once we reach the knees, you can pause. That's okay. How does that feel? Good. And if it feels okay, we continue through the motion, continuing down until you feel comfortable. Excellent. And now you can come back up. Good. I'm observing the motion through the entirety, looking for different signs of apprehension or twisting in the pelvis. Next, we're going to perform extension. Again, making sure they know that the table is behind them, and I'll put my hand here as well, so my client has that additional bit of safety. What I'll get you to do now is just let your hands relax to the side and slowly lean back, and if you get into trouble, just let me know and we can move out of this motion. That's good, and we could come back up. Good. And just like before, I'm observing this motion to see any signs of apprehension or any twisting of the movement. Next, moving into lateral flexion. We perform lateral flexion on both sides, the left and right. So starting on this side, if you would please just put your hand by your side. Good. And then see if you can reach down and touch the side of your knee for me. Excellent. And come back up. And then we'll do it on this side. Excellent, and come back up. What we're looking for with lateral flexion is, again, a twisting or rotation movement. What you might see is your clients will twist down one direction or they'll twist up, compensating the movement if they have pain or discomfort. Lastly, we're going to perform rotation actively. If you'll take a seat, please. Now that we're in a seated position, what we need to do is make sure that our client is fully on the table, so back up until your legs are touching the edge of the table for me. Good. And we do so to stabilize the pelvis during rotation. So now if you would just give yourself a little hug, put your hands on your shoulders, right? And now turn away from me, please, as far as you can go comfortably. Excellent, and come back to neutral. Now turn towards me as far as you can go comfortably. Good, and come back to neutral. I would like you to note the language that I'm using, and you can relax. I ask my client to turn away from me and turn towards me. And during lateral flexion, I tapped on the side and I'd say, on this side, can you try and touch your knee? And now on the side closest to me, try and touch your knee. I do my best not to use the words left and right. Although I certainly do use left and right, I do so minimally because it can get confusing. You'd be surprised how often you say left when you actually mean right, or you say right and they move to their left side. So doing your best to tap on the side or indicate the side saying towards me or away from me is much more ideal. Excellent. Now let's move into passive range of motion. Hey, thanks for watching, and don't forget to subscribe. If you would like to learn more about orthopedic assessment, click the link in the description below and register for a free training on orthopedic assessment, where I'll take you through my entire assessment process beginning to end, step by step, and teach you my 3 secrets to get more out of every session with my clients. I'll see you there.